Today, December 1, is World AIDS Day, and this is what we're working with this year on the fast track to end AIDS. Already, 15 million people are accessing life-saving HIV treatment. New HIV infections have been reduced by 35% since 2000, and AIDS-related deaths have been reduced by 42% since the peak in 2004. It's all well and good, but that disease is still very deadly. Our concentration today is on children. Globally, between 2002 and 2013, there was a 58% reduction in the number of new HIV infections among children under 15 years of age. Despite this, more than 240,000 children were infected with HIV during 2013, around 700 new infections every day. In addition, millions more children every year are indirectly affected by the impact of the HIV epidemic on their families and communities. There were some 3.2 million children living with HIV around the world at the end of 2013. That's representing some 91% of them in Sub-Saharan Africa. So 91% of this figure that I gave here in Sub-Saharan Africa. In the same year, only 24% of children who needed antiretroviral treatment received it, and 190,000 children died of AIDS-related illness. So you know that this is a very important subject for all of us. It's good that we all pay attention. My guest is one who is very much qualified to talk on this subject. Dr. Adroina Asante is a specialist pediatrician with the Korle Bu Teaching Hospital. Good morning, Doc.
Good morning.
Thank you. So take us through the basics again. How can children get infected by this deadly virus?
Okay, so with the children, most of them will get the virus through what we call the vertical transmission. So what that basically means is that when the mother is pregnant, a mother who is infected with HIV is pregnant, she can actually transmit the disease to the child through first the placenta, that's in utero, or during the birth process, where we have a lot of blood during the birth process. You can also have the transmission of the virus from the mother to the child. And then thirdly, through breastfeeding after the child is born. Other ways in which the child can also have the virus is from receiving blood and blood products, or when the child gets into contact with sharps or needles that are also infected with the HIV virus. So that's basically how the children get the virus.
What I remember is, I think in the early stages of your pregnancy, or just when your doctor realizes that you're pregnant, they carry out the test.
Yes.
Why is it so important for mothers to test early for the virus?
It's because now there are drugs that the mothers can take that can actually reduce the viral load for the mother, and so would actually reduce the risk of transmitting the virus from the mother to the baby, both in utero and during the breastfeeding period. So now it's very important that the mothers go for their antenatal care, they get tested, and they are started on the drugs before they deliver, and right after that they also continue with the drugs through the breastfeeding period. And even the babies after they are born are also given drugs, all in a bid to reduce the risk of transmission from the mother to the baby.
But you're saying that somebody who is infected can still breastfeed the child who does not have?
Yes, you can still breastfeed the child who cannot have, because we've actually done studies that show that now there's just about 3% transmission from the mother to the baby who is breastfeeding. And so once the mother is on the antiretroviral drugs, the viral loads are very low, and so it's very safe for the mother to go ahead and breastfeed the baby. Because we weigh that as against a mother who is not going to breastfeed. The baby is going to be on formula feeds. Mothers are not able to afford the formula feeds, and then the babies come in with malnutrition, and that is actually a worse state than the child getting the virus. So it's very safe for mothers to breastfeed once they're on the antiretroviral therapy, and the babies are safe. And as I said, it's now just about 3% as compared to initially it being between 25 and 40% transmission. That was when there was no drugs for the mothers to take. But now there are drugs, safe drugs for both mother and baby, and so it's very safe for the mothers to go ahead and breastfeed.
How do we look like as a country in terms of the statistics with children?
Okay, so now with the children, we're doing very well. As I said, transmission rates is just about now 3% from the 25 to 40% initially. Now it's just about 3%. And then when you look at our prevalence rate as well, we've come from about 2.1 to now about 1.3%. So we're really doing well as a country. And we actually have our children living very long. We even have some of them who are now in the senior high schools. And so we are doing quite well in terms of the children.
These children who have the virus, do they know it?
So what it is that we have something we call disclosure. Now, at an age where we think that the child can actually comprehend what we are talking about, we are obliged to tell them that exactly what is happening. So that's around the age of 11, 12 years old. They're told why, because these children are going to be on drugs most likely from day one till forever. So they are about 11 years old, 12 years old, when they can actually comprehend what the whole thing is about. They are told that this is what you have. And so we counsel the parents first, or the caregivers first, as to how to go about the counseling. And then we also talk to the children as well. So at
have
the point,
you witnessed, a child who's been told? Because I'm just wondering, how do they take it and how do they live afterwards?
So it's a gradual process. So we don't just go ahead and say, this is what you have. We have counselors, we have pharmacists, trained pharmacists who are counselors, and these are trained counselors who go about doing the counseling for the parents first, because we actually prefer the parents to be, or the caregivers, to be the ones to do the counseling, because in a home setting, they are more relaxed. They sort of assimilate what the caregivers are telling them, instead of a total stranger telling them that this is what you have. So it's a gradual process till it finally sinks in that that's what we have. Yeah.
Do you find mothers, especially because they carry the children, I'm just thinking that if I transferred it to my child, I'll feel like guilty for the rest of my life, that this is what I have and this is what I've given my innocent child who didn't do anything wrong. Do you see such children surviving? You mentioned a while ago that some are in senior high school, but how far can you go? And can you be anything that you want to be?
Exactly. You can be anything you want to be. So far as you're on the drugs bring out your viral load very low. And so you can lead a normal life just like any other person.
Do you live normal? I mean, are you slimmer? Are you shorter or something like that?
Not at all. They have optimal growth just like any other children would do once they are on the drugs. Yeah.
Do you have to inform school authorities or something? Is there some kind of special care or attention that you need?
So that is one of the issues that we have to tackle right now, because as I said, now we are getting to the senior high schools. And if you're in a boarding facility where these children are on drugs all the time, there should be somebody there who is supposed to be oversight, seeing to them taking their drugs. And the fact that we also have issues with stigmatization. And so these children, as at the time they're in the senior high schools, with the authorities would have to be informed, so that it's not an issue of why are you on these drugs and letting it out to everybody. So at a point in time, yes, they are told what exactly is happening.
The people around them, should they know what they're going through?
Not necessarily, because we know adolescents and we know teenage issues. And so the most important thing is educating everybody, including the school children, about the fact that if you have HIV, if you have AIDS, it's just like any other disease, just like you have diabetes and you go on your drugs, or you have hypertension and you go on your drugs, or you have malaria and you take your drugs. It's just like any other disease. And so there shouldn't be that stigmatization where they will say that you are on this drug and you have this. No. When there's that general education, then it cuts across. Anybody can be sick, anybody can take drugs. And so it shouldn't be that you are on drugs and so you have this. So when the education cuts across to all the children in the schools, it wouldn't be an issue anymore. So that's one of the issues that we're actually looking at tackling.
But so first of all, school authorities knowing the condition so that they don't question you so much on the drugs that you're taking, or allow you to even take your drugs. You're saying if we had somebody who was also supervising even the taking of the drugs, that would be good. I am worried about the friends around you, the colleagues around you, the mates around you who would always realize that you're taking. Is it a lot of drugs we're talking about? We're probably talking about.
So sometimes they can be on 2 tablets.
Oh.
Sometimes it can be on 3 tablets.
So that's not so suspicious.
No. But knowing adolescents, knowing children, once you're on drugs, people will just be looking out and say, why are you on this particular drug? That's why it's important that you educate everybody so that it doesn't become an issue. Because everybody, if all the children would think that it's okay to take drugs at any point in time, they don't really need to know the condition for which you're taking the drug. That's fine. Yeah.
Let's talk about symptoms of this condition in children.
Okay. So in children, we have those who are born by mothers who have HIV, and so those children are like, we have a high index of suspicion for them because their mothers have it, and so we follow them up to test them at a point in time. And so these children might be just normal children growing normally. Now the other things you have to look out for is a child who has recurrent fever. So if I say fever, I mean high temperatures of 37.5 recurrently for more than a month. That should create the suspicion. If you have a child who has a chronic cough, child who is coughing continuously for more than a month, that should also give you that suspicion, because these children are also prone to what we call tuberculosis. And so it's important that a child who is coughing for more than a month should alert us that we should do the test for the HIV virus. The other thing is a child who is not thriving, because ideally a child who is being fed well should thrive. And so if you have a child who is not thriving amidst all other things being done for the child, then that's also another suspicion for the HIV infection. The other thing is when they have chronic diarrhea. So a child who is always passing loose stools frequently for more than a month, that child should also be, should give a suspicion of the HIV infection. And then what we mostly see is a malnutrition. So these children come in very malnourished. And so that's also one of the indicators for you to test for the HIV virus.
Yeah. From where you said as a specialist, do you see that we're taking care of pediatric AIDS children well?
Yeah, we are. So for instance, in Korle Bu Teaching Hospital, we have a clinic set up specially for the children living with HIV. And even for those who are born by HIV mothers. Because remember that the fact that you are born by an HIV mother does not mean that you have HIV, so you are tested. So we actually follow these babies up, and then we follow the older ones as well. We have regular clinic days for them. We do it every Wednesday. We have a clinic for them. We have specially designated pharmacists who see to their drugs to make sure that they're being compliant and they're taking their drugs as they should. And so I think we're taking very good care of them.
How do mothers and parents relate to their children, even in the very early stages when they're told that this is a condition that they have and they've transferred it to the children, or perhaps the children don't have it yet?
So what it is that, as you said earlier on, some may have the feeling of guilt that I brought this on to my child. But with a lot of counseling, with a lot of talking to the mothers at the clinics, we sort of reassure them that all is not lost yet. Because the fact that you have it doesn't mean you've transmitted it to your baby until the baby is tested. And even if the baby is tested and the baby has, or the child has the disease, there are drugs that the child can be on, and the child can lead a normal life just like any other person. So we always give them that hope and assurance that the fact that the child has it doesn't mean that that's the end for the child, because there's hope for that child.
So do parents willingly, readily come to the clinic on the days that you've just mentioned?
So we have appointment days for them, and once they see the good things that the drugs are doing for the kids, they willingly come in during the appointment days, and then they are seen too. So they come for their clinic days, and our clinics are quite heavy. Yeah, they come in willingly. Yeah,
it's a very sad thing. I think anything about children that hurts them, it's kind of sad. What would you tell a child like that, especially the adolescent who is now in the secondary high school? Would you say that you can get married and live, that kind of life after your education?
Yes. So that's the other aspect where we say that they need that psychological counseling as they're growing up. And so it's very important that they are growing up, you let them know that they can lead a normal life. They are adults who are married, who are living with HIV. They are married, they are living normal lives. And so the fact that you have HIV doesn't mean you cannot live like any other adult. So it's part of the psychosocial counseling that the adolescents are being given as of now. Yeah.
You can send me your message if you've got any question or comments that you want to make on my WhatsApp platform, which is 056800,000. We're talking HIV and AIDS in children. My guest is Dr. Adroina Asante. She's a specialist pediatrician with the Kolibu Teaching Hospital. Okay. Hi, you two look good. Grace from Amfraga is sending this message. Says, I learned HIV/AIDS do not stay outside for 24 hours. How true is that? I'm not sure if I quite get what you're asking. HIV/AIDS doesn't stay outside for 24 hours. Do you kind of get it? Okay, so you probably have to come again so that we can get a better understanding of what you were saying. But if you've got a comment, you can send it to me on 0560-800,000. I'm just wondering how young children, in most instances, very innocent, who end up getting the virus. That's where our focus is today on World AIDS Day. All right. So, Dr. Asante, are there times that we will miss detecting the virus in the mother, and then the child, ends up getting it?
Yes. So for instance, the mothers who do not attend the antenatal clinics, they are the ones who would usually miss the testing. And so these mothers would not be on the drugs before they deliver. And even after delivery, because the mother is not on the drugs, because the mother was not tested, it's not likely that the baby will be put on the drug right after delivery. So there are cases where we see them later in life where they present with any of the symptoms I've just elaborated on. Yeah.
How often do we lose children, because they have the virus, who perhaps didn't detect it early?
It's because now there's awareness, and now most of these mothers would attend the antenatal clinic. It's actually mandatory for everybody who attends the antenatal clinic to have the test done.
You actually don't even tell us, you just do it.
No, the mothers they go through. So we have something called the prevention of mother-to-child transmission, where these mothers are cancelled before they go through the test. So it's not just
I wasn't cancelled; they just did it.
Where did you do your antenatal clinic? Because you actually cancelled as to what the test is.
But it's not like you have an option, do you?
Well, it's most of the time, I'll say that you are supposed to do it for your own good and for the good of the baby. And so most of these mothers, once they are counseled and counselled well, will just go ahead and do it. It's voluntary. You have to do it for the sake of you, yourself, and the baby. Especially if you know that if you are tested positive and there's something you can do to prevent the transmission from you to your baby. Every good mother would want to do that for the baby. Yeah.
I know some men who say, oh, once my wife is tested negative, then it means I'm negative.
Not necessarily, because we have what we call the discordant couple. So you can have one couple being positive, the other couple being negative. And so it doesn't necessarily...
Even when they have unprotected sex?
Yes, you can have, that's what we call the discordant couple. They can have one. So we can actually have some of the mothers testing positive, but their spouses or their partners are negative. So it can happen. Yeah.
Okay, so I guess I'm told the question is, can the virus stay outside the human body for 24 hours? It's still kind of complicated, isn't it? Okay. Is there any hope of cure in the near future? That's what somebody is asking.
So for now, we don't have cure. Actually, worldwide for now, we don't have any cure for HIV. But what we do is we have the drugs that would bring down the viral load. I'm sure with research going on every day, most likely one day we'll come up with a cure. But for now, there's no cure. But then the drugs would bring out the viral load so low that it's close to we having a cure.
And I think from last year, what I was told was that now even the quantity of drugs that's coming down, so that's also reassuring.
There are new drugs coming up every day, and so the viral, the pill load is reducing gradually.
This one says, I have been tested positive and my wife negative. Can my children who are 7 years and above be positive?
So if if the mother is negative, it's not likely that she might have transmitted the disease to the children, because it's not from the father's side, it's from the mother's side. And so if the mother is negative, it's not likely that she would transmit the disease to the children. But being in a home setting, you don't know what might have transpired, because if the father uses any sharp objects with blood on it and the children go ahead and use the same thing, there's the risk of the transmission. So you can't say 100% no. The most important thing is you could get the children tested just to be sure we are okay.
All right. This is Mohammed Dankwa confirming, because he says my wife was cancelled before she was tested. I stand alone on this, I guess. Please ask the doctor what they're doing about HIV patients who are intentionally spreading the disease. Samuel in Esiama asking this question.
Well, I guess this is a social issue. And so all of us as a nation with good education to everybody, just to be careful when it comes to your sexuality, or when it comes to your sexual preference, that would help. Because as of now, I don't know of any law that could hold anybody for doing that. So it's just a matter of education for everybody and create the awareness that HIV is real. And so we should be more cautious when it comes to.
Sure. I'm Dennis Bansa from Kufrodia. How many times is a pregnant woman tested for HIV? Because I've seen a pregnant tested in early pregnancy. Okay, so I'm sure you're saying that you've seen somebody who was tested early and it was negative, and after delivery she becomes HIV positive and the baby is also positive. Okay, so that ties in with the question I asked.
Yeah, so you test it early pregnancy, late pregnancy, because in between you could also contract the virus. And so early pregnancy, late pregnancy.
So late pregnancy is how many months?
Third trimester. That's, so third trimester, let's say from 7 months onwards, and the early one before 14 weeks.
So I guess the doctor missed the second one then?
Yes.
Can you sue a hospital or a doctor, in this instance? Because how are you supposed to know?
Well, when it comes to sue, when it comes to the law, I don't think I'm an expert in it.
I'm just saying that
I don't
you're my doctor and you're supposed to test me.
And
you do the early one and it's negative.
Yeah, but you see, the thing is, you could have contracted it between the first trimester and the last trimester. We have a window period of about 3 months, and so probably during the time we were tested, you had not seroconverted yet, but then later on you do, and so you cannot sue the doctor for that. I
get it. I had a needle prick after it had been used by someone. When I told a friend, she said nothing will happen to me because the needle has stayed for more than a day. How true is that? Well,
for us, what we say is that it's always good to prevent harm. How sure are you that this? How sure are you that this needle has actually stayed up for more than 24 hours? So in instances like that, we'll have what we call the post-exposure prophylaxis, because you don't know who the needle has pricked and all that. So the most important thing is, once it's a high-risk situation, for instance, if it was in a hospital facility or a public place where you think that there's a likelihood that this needle might have pricked somebody, you go in for the post-exposure prophylaxis, and that's given for about a month, just to make sure you're safe.
Sure. So finally, in wrapping up, I mean, what's that message that you have for all of us, either parents or children out there, people who take care of children on this World AIDS Day? Okay, so what we are trying to say is that if you improve the health of these children who are living with HIV, then you are likely to have a HIV-free generation. The most important thing for us now is the awareness. Let's know that there's hope for these children. Once they are on the drugs, they can live just like any other person can do. And so we should stop the stigmatization, bring out these children, let them be on the drugs, and they'll be fine. Amazing. Thank you so much for your time. Thanks for coming, Dr. Adraina Asante, Specialist Pediatrician, Korle Bu Teaching Hospital. We're most grateful. Stay with us. You're still watching the AM show.